Is nursing an art or is it a science? It's a classic debate, right? The compassionate touch versus the hard data. But here's the thing. We're going to break down why it's not really an either-or question. The answer is both, and how they come together is pretty fascinating.
When you picture science, what's the first thing that pops into your head? For most of us, it's probably beakers, white lab coats, maybe some bubbling concoctions. But what if I told you that some of the most critical science doesn't happen in a lab at all? What if it happens right there, at a patient's bedside?
Okay, so before we can really dig into nursing, we have to start with the foundation of, well, pretty much all reliable knowledge. We're talking about the scientific method. It's the universal playbook for figuring things out. You definitely learned this process back in school, and for good reason. It's such a logical pathway to discovery, isn't it? You observe something, you form an educated guess, that's your hypothesis. Then you design a test, you analyze the data, and finally, you draw a conclusion. It's the fundamental process that takes us from just thinking something is true to actually knowing it is. But what really gives this method its power are these four core principles. It has to be systematic. You follow a logical order. It's objective, meaning you try to keep your own biases out of it. It's empirical, which is just a fancy way of saying it's based on things you can actually observe and measure. And crucially, it has to be replicable. Someone else needs to be able to repeat your experiment and get similar results. This is what makes it the gold standard for creating trustworthy knowledge. So, with that foundation in mind, let's turn to our main topic. We're not throwing out the rulebook when it comes to nursing, not at all. Instead, think of nursing research as a specialized blueprint that's built right on top of that same scientific foundation. And hey, you don't have to take my word for it. The American Nurses Association defines it perfectly. Notice the key words here: systematic, scientific inquiry, and trustworthy evidence. This isn't about hunches or just doing things the way they've always been done. It's about building a body of reliable knowledge specifically to improve nursing. So we have the scientific method and we have nursing research. How much do they really have in common? Well, as we're about to see, their foundations are pretty much identical. Just take a look at this chart of the nursing research process. Does it look a little familiar? It should. Formulating a problem, developing a hypothesis, designing the research, collecting and analyzing data. It's the same fundamental cycle of discovery we just talked about. It's the scientific method, just in a clinical setting. So here's the crucial point. The core principles are identical. It's a systematic, objective, evidence-based quest for truth. But there's one enormous variable that changes everything. The subject of the study isn't a chemical or a plant, it's a person. And this brings us to the most fascinating part of the comparison. You can't treat a person like a chemical in a test tube. So when you're dealing with the complexities of human beings, the scientific method has to be adapted. Here's how. Nursing research uses two main toolkits to get the job done. On one hand, you have quantitative research. This is the classic approach. It measures things numerically. It asks how much or how many. But then there's qualitative research. This toolkit explores the human experience. It asks why or how. You can't put a number on a patient's anxiety or a family's journey, and that's where this approach is so powerful. So why the need for two different toolkits? Well, first off, ethics. You simply can't conduct potentially harmful experiments on people. Beyond that, humans are just plain complex. Our feelings, our beliefs, they can't always be measured in a lab. And finally, nursing takes a holistic view of health, looking at the whole person. The science has to be flexible enough to account for all of it. Okay, so we have this adapted, human-centered scientific process. But what's the end result? What does all this research actually build in the real world? The goal is something called evidence-based practice. And it's the simple but profound idea that every decision a nurse makes should be based on the best, most current, scientifically backed evidence available. And this right here brilliantly shows what that looks like. This is real data from a study on patients with lung disease. A nurse looking at this can see, based on hard evidence, which medications work best for patients with severe symptoms. This isn't guesswork, it's data-driven care. This is how research translates directly to a patient's recovery. This quote from our research really just sums it all up. Nursing research isn't some academic exercise. It generates the only valid knowledge that nurses can truly rely on. It's what transforms nursing from a practice based on tradition to a profession grounded in science. So, at the end of the day,
It's not a question of art versus science. It's the art of caring, guided and strengthened by the rigor of science. Which makes you wonder, what piece of conventional wisdom, what long-held tradition that we take for granted in healthcare today, will be the next to be transformed by this powerful process?